my colleagues may have understood every single word so far. I have to be honest, some of it was a bit over my head. And what I'm trying to understand is, in your view, what the tax does, and what if you were successful at the ballot, how that would change the way the tax works. Can you help explain that as simply as possible?
Less nerdy.
Yeah, okay. I'll try. As we've heard quoted before, healthcare is complicated. It is very complicated. It's something that I've spent my life in since 1994 when I became a dental provider. Was there at the beginning of the what they called OMAP. That eventually became the Oregon Health Plan. And then it transitioned into the ACA. I've been there as a contractor, I've been there as a provider, and now I've been in the legislature. So I've had, almost 25 years of going through this process. It's a very complicated process. But one of the things that this tax is going to do, and has already done, if you look at the counties across Oregon, you start to see a monopoly being developed with only one health insurance. County after county, about 17 counties now only have one choice, where they used to have 2 or 3 health insurance, but then the state has come in, kind of cut special deals with one insurance, say, well, we have to have you there, so we'll let you increase your rates up to 15% or more, double-digit increases if you stay in that county, right? And so the tax is not just the 1.5%. It has created a monopoly with insurance companies where there's only one choice, where those people that pay full rate, the small businesses, they no longer can go out to their insurance provider and say, give me 3 quotes. There's no competition anymore in a lot of these counties. That's where it's really hurting people. It's really hurting the small business, because it's not just the 1.5% tax. It's the fact that there's only one insurance company left that they can go purchase from, right? And we're seeing that across the state of Oregon, and that's a direct result of what we're doing with this tax.
So what part of the tax would be overturned if the referendum is successful, and how would that change the revenue picture?
Well, our offer has always been, and again, I wrote, with help from others, I wrote a House Bill 3467, which would have approached this different. Didn't get a hearing, right? And so we didn't have alternative. There was $50 million on the table that was used as a sweetener to the insurance companies. If we give this $50 million to you, will you charge your ratepayers $100 million and give it back to us, basically, to put it in simple terms? Well, the insurance companies accepted that $50 million, and now they got a law that says they can charge their ratepayers double that, a little over double that, and pass it through to their ratepayers. Well, we wanted that $50 million to go to offset the cost of Medicaid. And so if you match that $50 million for the ACA, that ends up paying for a lot of people covered for a year. You can cover with $50,000 of stateside, you can cover about 80,000 lives for a year on the ACA. But they didn't do that. They didn't take that approach, because it's a 95%, 94% cost ratio. I know that's complicated to look at it from that standpoint, but when you cost shift that money out of a program that was there for a reinsurance program in the past that failed, and you take that $50 million and you give it to the insurance companies, and then you say charge your ratepayers, the losers in that are the small businesses that now only have one choice to go buy health insurance from.
And understand, besides double